in developing countries around the world, throughout Asia and Africa, in Latin America and the Middle East. Darkness is giving way to light. Despair is giving way to hope. The goals of Vision 2020, the right to sight, are being realized in the lives of millions of people. Founded in 1999, Vision 2020 is the global joint initiative of the International Agency for the Prevention of Blindness and the World Health Organization. Institutions, corporations, healthcare professionals, governments and non-government organizations have joined forces to rid the world of avoidable blindness. The strategy of Vision 2020 is built upon a foundation of community participation with three essential elements: cost-effective disease control interventions, human resource development, infrastructure development. Because of the steadfast commitment of the Vision 2020 partners, to date, 15 million fewer people are blind compared with projections made at the time of Vision 2020's launch. Working together to eliminate avoidable blindness means that men and women are better able to support and care for their families. In India alone, 4 million more cataract surgeries are now performed each year. In Africa, children now have a better chance of developing to their full potential. When Vision 2020 was launched, 5.9 million people suffered from the effects of blinding trachoma. That number has been reduced to less than 2 million. Pfizer's donation of Zithromax medication has made a substantial contribution to this. Because of the efforts of Vision 2020 partners, the number of people blinded by river blindness has been reduced by more than 50%. Thanks to the Merck donation program, 75 million people are now treated each year, and the goal of elimination is at last feasible. The Vision 2020 campaign is succeeding on many fronts, but there is still much to be done. Today, 45 million people are blind, 269 million are visually impaired, and most of them live in the developing world. Without effective intervention, the number of blind people will increase to more than 76 million by the year 2020. Millions more will have vision so limited they will not be able to lead productive and independent lives. Women face a significantly greater risk of vision loss than men. 2/3 of blind people are female. Aging populations mean that chronic blinding conditions such as diabetic retinopathy will continue to rise. The tragedy is that 80% of blindness is avoidable. Thanks to Vision 2020 advocacy, all of the 193 World Health Organization member states have promised eye care investment. Those promises must be kept if we are to meet the reachable goal of eliminating avoidable blindness. Australia, China, Pakistan and India have all made significant financial commitments to eye health programs, and more governments must follow. The World Council of Optometry is the global organization for optometrists and students of optometry. Optometrists provide comprehensive eye and vision care, including refraction and dispensing, detection, diagnosis and management of disease in the eye. They are key partners in the fight to eliminate avoidable blindness, providing care in their communities, in clinics as well as hospitals. 250,000 optometrists in 48 countries are working with their national and regional optometry organizations, associations, councils, schools and institutions to form a unifying voice and catalyst for this important work. The scale of uncorrected refractive error around the world is immense. 670 million people are needlessly blind or vision impaired simply because they do not have access to an eye examination and a pair of glasses. Many children in school for the blind are not blind at all. They simply need a pair of spectacles or low vision aids. the World Optometry Foundation raises funds to support WCO's work to eliminate avoidable blindness. The World Optometry Foundation is also a founding member of Optometry Giving Site, the only global fundraising initiative that specifically targets the prevention of blindness due to refractive error and to help those with permanent low vision. WCO is developing programs to create sustainable solutions to blindness prevention and treatment. Education is a crucial part of that. Tens of thousands of people in the developing world are being trained in optometry. Many more are upgrading their education to maximize the impact they can have in their communities. Working together, we can support sustainable developments such as New Vision Centers and the Global Resource Center, which is bringing millions of pairs of affordable glasses to Africa. The work of optometrists in eliminating avoidable blindness is vital. It is one of the major public health challenges of our time. Optometrists around the world are playing their part every day to ensure that the people of the world have good eyesight and are free from blindness to enjoy a higher quality of life. As we move closer and closer to the year 2020, now is the time for action. Now is the time to refocus on the mission that we accepted in 1999. To create a world in which no one is needlessly blind and where those with unavoidable vision loss can achieve their full potential. Avoidable blindness robs millions of their right to sight. Imagine if working together we could eliminate it. Vision 2020, the right to sight.